You can go ahead.
Good morning, everyone. It's great to see everyone here on this little bit chilly, feels like December morning out there. We appreciate all of you and all of your time and energy. It feels like it's been a long time. The last month has been a busy month. So really glad to see you. We are going to jump right into our agenda today because we have a couple of guests and they have hard stops. So we want to give them plenty of time and really appreciate them joining us. First up this morning, we have Dr. Cam Wolf from Duke. He is an infectious disease specialist and has been really helping to lead our efforts at Duke around the vaccine, and I think has some good news, encouraging news for us around on the vaccine front. So wanted to give him time to be able to share and update this group on where we are around the vaccine and planning moving forward. So Cam, I will turn it over to you.
Hey, thanks so much, Katie, and I appreciate everyone letting me come on. Thank you, and happy Friday. Let me see if I can't just share my screen. You'd think I'd be better at the technicalities of this 9 months into Zoom life. Can you see that?
We've got it, yes.
Yep.
Thank
cool.
you.
So yeah, I think I spoke to you a few months ago, maybe now. It's a bit of a blur about vaccines that were coming, and we're sort of now in a position where we can really do it. And I sort of want to describe a little bit of what's happening in the background from our end. Excuse me. So we've had a vaccine work group here that myself and a couple of others co-chair for now a couple of months, trying to sort of prep for the unknown in many ways. And have very intentionally tried to engage a pretty wide variety of folk who we thought would be included, including folks from the county health department specifically. And I want to sort of relay a little bit of the work that's going on there and then reflect into what we know and still need to find out about. So for those of you that haven't heard, yesterday the FDA announced an emergency use authorization for the Pfizer-BioNTech vaccine. And so that's sort of the first legal step to getting vaccine out into the community. It was a fairly clear vote. You might look at 17-4 and say, well, hang on, like, what do those 4 people have opposition to? It was all about the fine point of whether kids 16 to 18 should be included in vaccination. It had nothing to do with safety. If the first of the main phases of the Pfizer vaccine that were trialed in phase 3 were actually all to do with adults. And so it remains a little bit of a question about pediatrics, and there was some debate as to whether older teenagers should be included. So they represent the no's there. What's going to happen from our end, and in fact this is true for 10 other hospitals across the state, is that we expect on Sunday or Monday to get a forward deployment now of the Pfizer vaccine. It's basically been waiting in deep freezers in order for the FDA to clear it. On Monday, the state's ACIP, Vaccination Committee, essentially review not only what the EUA has decided about the vaccine and review the safety data, but essentially give us a roadmap as to who we should be dosing it for. And that roadmap is largely socialized already, and I'm going to walk you through some of the details. We don't expect the ACIP to throw any late surprises on us, but we need their authority to then finally go ahead and start vaccinating. Typically, the ACIP's recommendation is what allows Medicare and Medicaid and then third-party payers to also buy into the entire process. So we are anticipating a start date of the 15th, so Tuesday. So we are right on the doorstep of vaccination clinics beginning here at Duke, and then shortly thereafter throughout the rest of the community. And for full disclosure, it's then Thursday when Moderna, the other US-based country, go through the same process, and we do all this again. Moderna has a very different cold chain supply, so we expect that our supply at the hospital will be entirely Pfizer because we have deep cold chain freezers. Whereas the Moderna vaccine will be much more relevant to county health departments and to the community more broadly, particularly, I think, to nursing home populations, for example, early on, as it requires freezing, but sort of more akin to the standard home freezer temperatures, not the sort of laboratory deep freeze. So I wanted to give real quick high level view of what we know from these vaccines. So the Pfizer vaccine has a really extraordinarily efficacious data set. So this is based out of 43,000 people, and 95% efficacy means of 100 people who are going to get sick, 95 don't. That's profoundly better than what I would have anticipated. Like if you had the FDA at the start of the year said, look, we'll let a vaccine pass our threshold if it gets past 50. And to put that in context, a typical flu vaccine, we're celebrating if we get toward 50% protection. Whereas this is sort of putting it up in the really unprecedented area for respiratory viruses and much more akin to what we think of say, a tetanus vaccine, where it's incredibly protective, or rubella, for example, where we just don't see it and people have been vaccinated. So this is an outstanding result. It reduced both severe cases and non-severe, and therefore we think by extrapolation, asymptomatic cases, although they weren't tracked in the trial that looked at this. As I said, it has some cold chain issues that are pretty unique. And I think up front, we want to acknowledge that this was intentionally, there was a big effort by both Pfizer and Moderna to approach this vaccine, both vaccine trials, in it with a view to diversity that may not have been frankly done in the past with typical vaccine trials. I don't think 40 to 60 split necessarily is perfect diversity, but I would say that it's far better than what we've achieved in the past. And given that the pace that this was done, I'm pretty pleased with that. And most importantly, there were no differences in safety or efficacy profiles seen across that split. So it didn't matter your age, more than 55, less than 55, the efficacy was the same. And nor did it matter your ethnicity, racial background, or other factors that were tied into that. So that's, again, further reassuring information. The Moderna vaccine that we know has almost synonymous data behind it. So 30,000 people, very similar sort of diversity breakdown in who they were able to include. Similarly, 94.5% efficacy, so an outstanding result. And really the only difference, again, being the difference in how we on the back end need to freeze it or deep freeze it. So at least from my end, I don't think there should be any arguments about, oh, hang on, I want to wait for that vaccine, not this one. That they should be functionally the same from everyone's perspective. There are a couple of vaccines still in development trial, and I think what's fair to say is that their future now becomes a little more unclear, given that they're not the first cabs off the rank. The AstraZeneca one here is probably the furthest along, which achieved an efficacy on the whole of about 70%. Which if that was released first, we would have been jumping up and down and celebrating, but compared to 95, and now it looks a bit inferior. It has a global impact that will be far different though, because its production is cheaper and easier and has probably global rollout potential that's far more influential than those other two that require deep freeze, but may not, I think, be so useful for us in the first phase. So, to visualize it, this is what we saw on Friday when the Pfizer data became available to us. The red line there represents new cases of infection in folks who took the vaccine. The blue line represents cases of infection over the days that they were tracked in people who didn't. And if that sort of separation that on the little zoom in occurs really around day 10 after the first dose, doesn't wake you up and go, boy, in the middle of a pandemic, this is something I want to do, then I don't know what other data does. This is as clear as it comes, at least in terms of vaccinology. So, what else do we see from that data? And apologies that I literally snapped this off a page on the Washington Post. It's a bit fuzzy, the picture, but, there are some side effects to this. And I think we need to be really transparent with our patients and community members as to what they are. The last thing we need here is for a lack of trust. And so let's talk about what these side effects mean. So these are what are called provoked symptoms. In a phase 3 trial, people come along and are asked specifically, did you experience fatigue? Did you experience chills? Did you experience fever? Did you experience vomiting? And so what you find is intentionally you try and get as the full capacity of anyone who would report any of those symptoms when asked. That's a different standard than if I give you a flu shot and then you go home and you might feel a bit funny, but you probably wouldn't feel bad enough to tell anyone. You wouldn't feel bad enough to take a day off work. You wouldn't feel bad enough to do anything about it. Maybe you take a Tylenol and you move on. So the interpretation should not extend to these are necessarily severe symptoms. Severe symptoms were found in about less than, I think about 4.2% or something. So, maybe 1 in 20. That's a significant difference. And so I think what we're seeing playing out in the media here is that there's a great opportunity for the media to try and pick cheap stories about side effects and difficulties with this vaccine. It is true that people will feel symptoms. We can't sort of sugarcoat that, but I don't know that they're going to be as severe as we may think if you just read the top line of articles. There were a couple of anaphylactoid responses in the UK on the first day that they rolled these out, and they were in people who already take EpiPens with them wherever they go because they know they have severe reactions. And the language that I think the FDA has sort of finally passed out, and we'll see that the CDC do the same, I suspect, is to say, look, if you have severe vaccine allergies in the past, that this is encouraged to have a discussion with the physician as to how you should go ahead and get this vaccine. The other thing we've got to be sensitive about is there's going to be side effects teased out of this that we need to compare to the expected rate of those events. So, for example, there's been a bit of chatter online about Bell's palsy, which, no one wants to get a Bell's palsy, but a certain percentage of us do every year, every day. And so when you vaccinate 43,000 people in 3 months, you're going to get a few Bell's palsies by accident. And it turns out that rate is pretty close to 4. So whether that's truly a vaccine effect or not, I don't know, but we're going to have to sort of think about the way we message these as a community. So I want to briefly talk about how we sort of target folks at Duke, and then this can be, I know Rod's coming next to think about sort of community expansion of this. The state and their guidance have talked about phase 1A being a broad array of sort of healthcare providers, as well as nursing home residents and nursing home staff. And so when we have tried to sort of wrap our hands around who this would be, we think it's actually about 5,000 people across our multiple campuses. And so we've sort of further subdivided those into 1A1 and 1A2 and used a lot of our ethics committees to sort of help us delineate what makes the most sense. In the end, our supply chain for the first week actually looks pretty robust. So I don't think we're going to get into the problems of having to sort of pass out, and sort of horse trade one staff member's priority rank over the other. I think it'll be as many as we can vaccinate. We just keep on going. So when you spread it out a little bit further, this is what phase 1 looks like. The only difference here is this is a slightly old slide with LTC residents actually now bumped up a notch. We don't expect that we'll see any difference here from the ACIP, but this is perhaps relevant to the audience here, because I think the moment you get into 1B and certainly into 2, you see phases of all of our community members. Frankly, an easier job for us, daunting as it still may be, is not the 5,000 staff that we want to get done in the next month or so or less. It's, how do we expand this into our 100,000 patients in a way that's efficacious and quick? Because at the end of the day, we have 2,500 people dying every day. There's a pace and an urgency here that's unique. We have had some community engagement intentionally. It's sort of split both between having county representation on our committees, and I hope to try and keep each other as abreast as what we can as we hear information coming to us, which has inevitably been piecemeal. And so that's to be expected. This is coming out quickly, and we're trying to keep each other abreast. We've tried where we can to engage both in our communities of color and Hispanic groups, and I think we'll need to moving forward, because whilst I hope that our vaccine hesitancy and frontline staff who've seen the impact of COVID will be less, I fear it will be significant across the community in general. And I can have a 95% efficacious vaccine, and if I don't get it to as many people as they need, it doesn't work. That's probably our biggest challenge in the first quarter of 2021, frankly. And that, clearly ties into all of our communication issues. So, what do we not know? And I think what do we need to be really clear about? We don't know what our supply chain is going to be. We've been told we get weekly redistributions, but, truly what does that look like? I don't have visibility on yet. Like we said, I think hesitancy will be an important thing. We need to be upfront and unified on the way we message this. This is a safe vaccine. There are some groups who don't know what the vaccine's all about. So there were not pregnancy or immunosuppressed people included. So if you were a transplanted patient, if you're on chemo, you weren't in part of these trials. And so our message would be that if you fall into any of those groups, language we believe will be permissive for you to receive a vaccine. I just can't tell you whether you ultimately achieve 95% protection or maybe 50% protection. But that's better than zero, and we're in the middle of a pandemic. So a careful discussion, for example, is what we're encouraging with folks in their third trimester of pregnancy, or even second, where we can say, look, you know, hey, your risk is higher. Let's talk about what this means in terms of a risk balance calculation. And to be fair, we know nothing about the durability of these. We don't know if they last 6 months or 6 years. We haven't been following them long enough to figure that out yet. And yet, that doesn't matter when we face a pandemic that's peaking at the moment, because really, if this only lasts until June, that still breaks the back of a pandemic. You know, clearly I'd like it longer, but at the end of the day, that doesn't bother me one iota, although people will bring it up as a concern quite reasonably. So I'll stop there. I'm more than happy to ask questions. I don't want to cut into other people's time though. Thank you.
Thank you so much. I am sure there are some questions here, and maybe are there specific questions for Dr. Wolf, or if we want to also have Rod add in from the health department perspective, perhaps, and then open it up to questions.
Morning, everyone, and you know, big shout out and thank you to Cam Wolf, who has been a trusted partner throughout the entire pandemic, from his participation with long-term care facility outbreaks to everything he just said. I won't add too much because Cam did talk a lot about most of the things that I was going to talk about, and I think it would be great, a great time saver. The only thing I will add, ladies and gentlemen, is that we have been working together in concert with Duke, the Office of Emergency Management, Public Health, Fire and Rescue. We've been doing a lot of collaborating over the course of the months. And as Cam has indicated, there's a lot that we don't know as it relates to supply chain. And the allocation, it's important to note that the allocation of vaccine will really depend on, you know, what we're able to do. As he's indicated, Pfizer is, you know, has an ultra cold chain responsibility. So for the most part, that's going to the hospitals next week. The week of the 21st is when local health departments can expect to receive shipments of Pfizer and Moderna. And as Cam has indicated, Moderna is mainly set and targeted to go to local health departments because of such a less rigorous cold requirements, if you will. As far as I know, and I'm talking about meetings that just took place yesterday for with local health departments and the Department of Health and Human Services, North Carolina is expected to get 85,000 doses of Pfizer, and the allocation will be based upon hospital size and county population. So I think that Durham is well positioned to receive quite a few doses. The Moderna allocation, from what we're told, is based upon population size and density. And as Cam has just indicated, we simply don't know what that number is going to be right now. However, Durham Public Health is ready to receive it. Shortly thereafter, from what we're told, we can then expect a weekly rhythm of vaccine to just come on a more regular basis. So we're certainly looking forward to that. In terms of distribution, you know, we're certainly going to adhere to the federal and state guidelines as long as, you know, as it relates to the phased approach. And again, 1A is definitely going to be done sort of in a closed pod, internal type scenario, to where we're taking care of frontline workers, healthcare workers, anybody who really has direct contact with COVID patients, to include funeral homes who takes care of decedents, dental offices. You know, we don't definitely don't want to bore you with the exhaustive list, but we're definitely taking care of them first. And then, of course, long-term care facilities, the state and feds have a program already designated that will be administered by CVS and Walgreens. And as soon as those allocations are really tabulated, then Secretary of Health and Human Services, Dr. Mandy Cohen, has already provided explicit instructions that she really wants that to take place first, because a lot of the fatalities that we're seeing are coming from long-term care facilities. Trying to make sure I don't forget anything else. Suffice to say, it's fluid. Everything is really dependent upon allocation. I want to make a very specific statement about 1A, 1B, and I think Cam will agree. The ultimate goal is to get vaccine within the community, get vaccine within our healthcare workforce. By no stretch of the imagination will we want or desire to sit on vaccine due to the cold chain requirements and opening freezers, closing freezers. There's a heightened sense of urgency like never before to get vaccine out and get it in, get it out, get it in, get it out. So with that being said, we have been told that, don't get stuck up on 1A, 1B, 1A2, 1A1, whatever have you, get it out there. So we have been empowered to make liberal decisions when it comes to vaccines. If a certain group or segment still falls into that healthcare realm, we can definitely fully expect to get them vaccinated. I think the question that you all have is like, when is it going to be in mass distribution? I am hopeful, very hopeful, toward the end of February, mid-February is when we can really be able to start pushing it toward, I guess, open pods or within the community. But as it stands right now, there's a certain amount of uncertainty because we just don't know whether or not there are going to be supply chain issues. We don't know what our allocations are going to be. All of those things are going to be worked out. And I'm hopeful toward our January meeting that we will have a lot more definitive answers. Cam, I don't know if there's anything else you had to add, or if not, we'll kick it back over to Kate.
No, I think that's perfect, Rod. A good balance of urgency and unknowns.
Still, you're right. Still a lot of unknowns on this, but boy, this is encouraging news. We got our 2 cold storage freezers delivered to Duke Regional the other day, and I've never been so excited about seeing a new freezer in my life. But it really is this is a big milestone for us. So very encouraging, especially given the data that we're seeing out of Pfizer and Moderna.
And I will also add, Cam and Katie and others. It's amazing how things just kind of fall together. There's a partnership through a project called Accord with NC Central, and that's done under the leadership of Dr. William Pilkington, who used to be health director in Cabarrus County for like decades. And he just sent an email out to local health directors to say, hey, I have a freezer, 2 freezers, ultra cold freezer that you can have for free. Who wants it? I don't think my fingers ever moved that fast. They'll take it. So suffice to say, Durham Public Health will receive an ultra cold storage freezer mid-January to late February that can hold 56,000 vials of vaccine. And we got that for free just from our community partners. So that's very encouraging.
That's terrific.
That's great.
So we have about 5 minutes before Cam needs to step off. He's got a hard stop. So are there questions specific for him?
And I can stretch it a little bit.
Okay, thank you.
And while you're on here, so a question I receive quite often is related to the vaccine use in children. I know we've stated the trials so far just recently started recruiting children, and we do not anticipate approval in kids less than 16 for a few months. Can you speak to that a little bit?
Yeah, it's a good question, Ibukun. You're right. So there's extremely limited data in kids under the age of 18. So there is currently a trial that we are facilitating with Pfizer for 12 to 15-year-olds. So if folks know of interested 12 to 15-year-olds and their parents, then we are trying to roll that through just as quick as we can. But for the time being, there is no pathway here to get this done in kids. And part of that was medically important because they're not on the whole the people who get the greatest side effects. I think our strategy then needs, and you see this represented in the state priority listing, is to, when we get to a point of being able to protect high-risk parents of young kids and teachers of children at schools and sort of, daycares and creches, then that becomes functionally the ring protection for kids, knowing that we don't know what the safety of the vaccine is for them specifically. But you're right, not only is it not yet approved for children, but I don't have a timeline of when it will be, because that depends on the enrollment in those trials and the data they generate.
Thank you.
And that's a little bit different, I think, than the issue with pregnant women, for example, or my transplant patients who equally don't have that data, but do have a heightened safety risk for themselves, which tips the balance, I think, quite significantly.
Other questions?
I can see a hand from Wendy.
Mr. Jacobs?
Thank you. Thank you so much, Cam and Rod and Dr. Akinboyo. It's just so exciting that we're talking about this and thinking about Tuesday literally rolling out the vaccines in Durham. I mean, it's just thrilling. So what are your thoughts about the fact that it's going to require 2 doses and the strategy related to that, along with, of course, the temperature issues? So obviously this will be a more centralized kind of distribution, and just wondering about that. And then also wanted to hear your thoughts about just the messaging that we need to start rolling out today. I mean, we got a message from my chart, and all that, but just really concerned about the issues that you've raised, and we've heard already from Rod as well and many other people about what's the best way to get the word out, and how can we all work together on that?
Yeah, I mean, I'll speak to the first question. The second dose is clearly important. It does bump not only the protection, but it's likely to bump the durability of how long the vaccine lasts quite considerably. And we only have trialed it at the 3-week point. So I can't tell you data of what it's like if someone misses it and gets it at 6 weeks or 5. So we're going to try rigidly to stick with what the science is trialed so far, which is to get you back at 3 weeks. Part of the way the IT systems for us, and the one that the state will require all of us to use, is built around trying to lock in that second appointment when you get your first dose. And so not only do people sort of have to vote to pre-register with the state to have the state sort of log in their details, but that becomes the lever to lock you in for the second dose. In fact, they've assured us that as we roll through the first wave, they'll be allocating certain amounts aside in order to guarantee that second dose is ready. So that's a logistic headache. It'll make it more challenging, but it's important. And I think we just have to let people know up front that the expectation is that there is a second dose here. Separate challenge to that is that second dose has been the one that has more side effects associated with it. And so, one of the things I don't know that it'll be as big an issue as we make of it, but we're trying to be a little bit cautious is to not, for example, schedule our entire 50 ICU frontline nursing staff on the same day, for example, because I don't want, 10% of them the following day to have to call in sick because they feel like they've got fevers and chill. So, staggering sort of high intensity frontline workforce will be valuable there, but that's probably more relevant for the second dose. In answer to the messaging question, what I'm trying to do at least, and I'll be interested in what Rod would think on this too, is that not only partnering with the communication team at the state who are thinking very carefully about how they sell this, but to say 2 things, I think, up front is, number one, we should view this as a light at the end of the tunnel. 95% efficacy is utterly outstanding. And, that can break the back of a pandemic if we do this right, no question. And I think marrying that phrase with an understanding of just how safe these have been shown to be is going to be important, because there will be cheap shot commentary coming out from varied positions about how the fact that this has been rushed, or how the fact that this has had, insufficient data, or about the side effects. And let me say to all of you, the one message that I think is crucial there: has this been done quickly? Absolutely. And that's because we're in a pandemic. There's been nothing else on the plate of the companies doing this work, or the institutes who administer the trials, or frankly, all of us who participated as patients, to think about this year, except COVID research. And so it's enabled us to do this quickly. And if there's one part of our federal response that's actually worked smoothly, it's to lubricate all the wheels of the finances and sort of logistics in the background that have allowed stages of this to overlap and make it happen much quicker. But that hasn't impacted safety. So a typical phase 3 vaccine, you might expect sort of 4,000 to 5,000 people to come through a phase 3. This has had 45,000 people come through. So it's because of all those efficiencies, and because everyone's been so single-mindedly thinking about this, that we've actually got more safety data than we would usually have. And the only thing we don't have is durability, which, as I said earlier, I just don't care about, frankly, at the moment, really. So, I'm not trying to sound flippant with that in terms of not having to carefully follow safety after we give it to people. Absolutely, we do. But it's a false argument for people to say that this hasn't been studied long enough or in a diverse enough group of people to really feel very comfortable about it. And so that to me is the other split in the message. Yes, it's incredibly effective. And here are the reasons why you shouldn't be afraid to line up, because our route back to some sort of community and social and frankly economic recovery is through this vaccine. I don't see any way around that argument. Like, this is an economic reason to do this, not to mention, frankly, my own sanity at this point.
Thanks, Cam.
Sorry to be a bit of a soapbox there. Didn't mean to.
Can I ask one more question before, and I know you need to step off, but obviously beginning this vaccination next week, but we still can't let our guard down, correct? In terms of the need for vigilance around the 3 Ws. Can you just comment a little bit on that?
Yeah, that's a really good point, Katie, and probably also part of the communication is that, yes, this develops early protection. Yes, 95% is good. But I don't think for 2 reasons that can stop our efforts to mitigate, whether you've had the vaccine or not. Number one, I don't know ahead of time if you're going to be in 5% for whom it doesn't seem to make a difference. So I don't want folks to sort of drop their mask and go around and start hugging everyone. Number 2, I think, we're in a position of leadership where people look at us and look to us to set an example. And I think Durham on the whole has been way ahead of the curve, frankly, on setting very high standards in terms of masking and mitigation and social, sort of efforts to try and stop this, to our great credit. That's to all of you. This is not going to be in enough people's arms to give them protection for many months. And so the last thing I want to do is to have, 1,000 healthcare workers being seen to drop their guard and set examples that are taken up by the unvaccinated segments of our community and continue to afford more spread into areas that have not yet had the chance to be vaccinated. That'd be the wrong sell for this. And so, I think really for both of those reasons, this doesn't change anything from a masking and distancing perspective right at the moment. Will it begin to change those things, by maybe the end of the first quarter? Yeah, I think I'd be really optimistic about that. But it can't change anything in December or January, or we get more people sick. It's as simple as that.
Great. Thank you. Thanks so much for your time. I know you need to step off, but really appreciate your time and your leadership and all you're doing on this.
Hey, thanks so much, Katie. And thank you all for leadership here too. This is pretty unprecedented, but it's exciting. It should be.
Thanks, Cam.
Thanks. All right. Let's turn over, if we can, to Kurt on the agenda. We are getting an update on our community health ambassadors as well as Greenlight Durham. And I know, Kurt, you also have a hard stop, so we want to be sensitive to your time. And thank you so much for joining us today and for all your work.
Great, thank you so much. I'm going to go ahead and share some slides. I have just about 10 or 11 slides. It won't take very long, and then I'll be happy to answer everyone's questions. You can see everything okay? Excellent. So this is our update on the program. Overall, the program I think is going very well. We've started the program we just got the contract yesterday, actually a signed contract yesterday. So things have not gone in the normal order, but I'm still happy with where it is. There's also some areas I think we need to improve on, and I'll conclude with that, the focus areas of things that we're going to fix that we need to address more. You have probably seen the data. I know there's been a public health report coming, but you can see this is the Durham County data from yesterday's Department of Health and Human Services dashboard. Cases in Durham, just like about everywhere else, are spiking and going up. It's a time that we need to be offering programs like this. We desperately need the vaccination. We need to be doing everything we can. I would point out, when you look at the cases, and this is cumulative, so it's a little different than the reports that you all got that are more for the last week or two. But overall, in cases, you all have a higher percent. The cases are overrepresented among Hispanic and Latinx individuals in Durham, whereas you're 13% Hispanic in Durham, but 46% of cases or infections have been in the Latinx community. And additionally, when you look at mortality or deaths, African Americans, who are 37% of your residents, are 40% of deaths, so they're a little bit overrepresented. But Hispanic populations are underrepresented at only 11% of deaths. And the epidemiologists I've talked to have generally felt that was because of the younger age of the individuals, the cases in the Hispanic population. But it's key that we need to be focusing on both. There's a key focus on equity that I know is one of Durham's core values, and we have infused that into the program. As you remember, there are three main goals: reducing COVID infections, secondly, supporting your local businesses, and thirdly, increasing the number of businesses who are participating on the Back in the Bowl campaign. We've had several trainings. This was at our first training. We did this at El Centro. We're doing it in person, distance, spread apart. We do a 2-day training. The first part of the training is done by Zoom, second one in person. And the in-person component, after we've done this, we go out in the field and we work with businesses. Pilar has done a fabulous job finding local businesses that will allow us to test out and train our workers to where they're interviewing the store owner or the business owner, getting feedback, inputting this into the tablets and practicing. So we've then retrained everyone when we brought on some new ambassadors, and we're doing another training next month. So the training and retraining has been a sort of a key focus for quality control. Here are some of the statistics on our ambassador team. You can see we supported one of your local businesses to make the red shirts. We have 8 of them, 3 Latinx, 2 African American, and 3 white. And 5 live in Durham, and we have 4 who are going to be hired next month who are also Durham residents. So the majority of our ambassadors, as we had planned, are Durham residents. When they visit businesses, they bring a bag and offer them materials. So it's not just a purely educational intervention. So we're giving handouts, and there are all kinds of handouts, and several of these have been developed with a partnership at Duke Center for Advanced Hindsight about what do you deal with when you have a customer who's very resistant, how do you handle that, and so forth. So we are handing out posters that show that you're part of the Back on the Bowl program. We're giving out disposable masks. There are some cloth masks that we still have a supply of that we're also handing out. If you go to El Centro, you'll see boxes and boxes of materials. And I'm here in the office. I'm one of the only ones in my department, but because UNC rules, you have to ship to a business address. We can't ship them there. I've been loading up my car, and as has Sarah Vandergriff, our assistant, and driving them regularly to there. So we're giving out tons of materials. There's hand sanitizer that was given. This is very popular with the businesses, handing out hand sanitizers, floor stickers, and so forth. Here's people out in the field visiting local businesses. The businesses are, as you know, putting up the signs to sort of mark that we are participating in the program. There's the one of the ones that goes on the floor. Food trucks, we're visiting all types of businesses right now. And so I think we've got a great list, and we're now refining it. So these are I would say probably the 4 biggest highlights of the program. So first of all, we visited over 900 businesses. We don't get a completion every single time, because sometimes they have customers and they're packed, and they are not packed, but they have customers and they're busy, and we have to come back. Other times, some of the businesses are closed either temporarily or permanently, but we have 438 completions, which is really, we're very proud of. When we came into the program, it had plateaued at around 240 participants. Now we have over 600 listed. And so that's more than doubling of the participation. And I think we're going to see this continue to increase over time. We had an exposure at one of our sites a couple weeks ago. We had to shut the program down until people had a negative test. And then we anticipate that people are seeing this all over places. That I would love to be able to say by next month we're going to have X number of businesses. But if we do, if we do have exposures, we do have to take precautions. And fortunately, everyone's tested negative, and we haven't had any issues because we are wearing masks and I think doing all we can to protect our workers. Secondly, we've doubled the increase. I'm sorry, not more than doubled. It doubled overall participation, but in the Latinx businesses, there were only 10 on the back of the bowl before. Now we have over 120 listed on the website, and that number is going to continue to go up. So that's a 10-fold increase. Third, we've been now working with a lot of key partners, and I want to credit and thank Ryan for all he's doing to link us up with public health, food inspection folks we've been talking with very recently, city attorney's office. We have a meeting next week with them. GIS and planning have been amazing. We now have they're helping us map and visualize all the places that we visited and where the places we need to visit in the next month or two, and that's been super helpful. And we're now also have a call set up with Greenlight Durham to see if we can work with distributing and talking about their app to local businesses. And fourth, it's been a good resource distribution mechanism. So we've given out PPE, as I mentioned, educational materials, and potentially the Greenlight Durham program. Here's the next steps. So one thing we have not, that I'm not happy with, and I just learned this week, that we have not visited enough Black-owned businesses. And so this is really where we're going to focus our efforts very hard in the next couple of weeks, as well as January. So we have reached over 50 Black-owned businesses, but that's nowhere near enough. We've initiated some outreach to some local nonprofit and for-profit organizations. So we've been meeting with, just had a recent great meeting with the Durham Black Chamber of Commerce. We've been reaching out to a couple of these nonprofits listed. We are setting up meetings, and this is newer. So we have been really slammed just getting things going. But now we're going to really look back and say, how can we collaborate and partner with a number of the nonprofit organizations? As we've done our mapping, these are the 3 zip codes that we visit next. So we have 1 or 2 of the zip codes we're just about finished with, and we're now moving people starting Monday into these other zip codes. And so that's the next focus. And we probably will be hiring a couple more ambassadors, and we want to definitely continue to have a diverse group, but even be more diverse. Particularly, I think we will want to hire another 1 or 2 Black ambassadors. And lastly, our goal is to have visited 150 Black-owned businesses by the end of next month, and we think that's a very attainable goal because that's the push that we're having in these zip codes is what we're going to be focused on over the coming weeks. So that's a short update. We'll be able to tell you some more stories and interesting stories in a future one. But right now we've been spending so much time just in the field, training, hiring, building protocols. But I'm here. I'd love to answer any questions that you have and receive feedback on how we can improve the program. So thank you.
Thank you so much. Are there questions? This just represents tremendous amount of work. Yes, Commissioner Jacobs.
Well, Kurt, I just want to thank you for all of your dedication to this and the fact that you're personally involved in helping to transport materials and things like that just shows how your dedication and all of your staff and everyone to this. And I appreciate the fact that you realize where the gaps are and what needs to be done to focus on the Black community. So I do hope that the remaining, the new hires will be doing that. Wondering about the vaccine rollout, and has there been any discussion about how the community health, how the health ambassadors, and the Greenlight program, how we can just keep using these structures to also help with getting information out about vaccines when we get to the broader phase to get workers vaccinated?
Yeah, that's a great point. We're open to everything. In fact, we've talked about, should we do add-ons related to ventilation? Could there play a role in vaccination? I think, we want to be very nimble and adaptable and I think I'm open. I'll continue to reach out and talk with folks. I'd love to talk with the health, the health department, talk with the Greenlight folks. If there's a role that we can play, I think it would make sense. What we can also do is look at the most essential businesses. I mean, one of the things that you see, we know that the group 1A and 1B are set. The next group, as I understand it, group 2, there's a debate, will it be people 65 or older, or will it be essential workers? And there's thinking, and others may know on this call, but I think it's going to be essential workers. And so we could look at the businesses that have essential workers and do special outreach to them. And so focus on grocery stores, for instance, focus on other places where people are going to be exposed, and we could step up efforts to promote vaccinations. I'll be very interested in doing that.
This is Susan Amey. Your last slide went by too quickly for me to read the whole thing, but I don't know if identifying Black-owned businesses has been a challenge in any way. On our website, we have been curating a list of Black-owned businesses. I think we have something over 200, and we have contact information for those. So if that's helpful in any way, let us know.
Yes, it certainly is. It ends up, it's just for us, and again, I just learned this on Wednesday. We have not built the informatics systems and the data systems yet, because we're literally building all this at once. And so when I saw that number, I thought, oh my gosh, and it has to do with where the zip codes where we just started people, because we didn't have a mapping system yet. And we just said, you do this zip code, et cetera. And so we're underrepresented, but we're going to fix it really quickly. And we do have a list, the list you mentioned, and the Black Chamber of Commerce that we're going to be visiting. That's our top priority right now. Thank you.
So Kurt, I have a question for you. So thanks for your great leadership in this area, and think even more for identifying gaps that you have and targeting those gaps. And of course, this program is designed to help. And my question is centered on, do any of the ambassadors face resistance when they're out in the field trying to help?
Yeah, there's been a little bit of a resistance. It has not been that bad. Interestingly enough, we've had more people because refused or said, we just can't do this because their business and they're focused on their customers, than we have where people say this, we don't want you participating at all. Actually, I also meant to say, we focus more in the urban areas, but there's more outlying rural areas. And that's also what we're hitting next month in January. And we expect there may be more, resistance there. I talked with folks from the state food inspections, because we're in regular contact with them. He told me, at a training I went, at a meeting, we had on Wednesday where we talked about our program, they are encountering fierce resistance. They did a food inspection at a business, and one of the people said that they've had people pull tasers, guns, knives on people about mask wearing when they've said you need to wear a mask. One business actually required a customer to take off a mask to come in, and so the business was the issue. So we're hearing these stories, and it was interesting. The person said, wow, I think Durham sounds a lot more friendly and amenable than some of the areas that this person had where they've had experience. But we're really, really pleased and impressed so far. So I think there's been just a really warm reception. If you look at CDC data, they've done studies to look at what percentage of the general public wears masks. The highest percent is among African Americans. That's the highest. And then Latinx, and then white individuals have the lowest rate of mask wearing, based on the last CDC data that I looked at. So the groups that people are, and also people are now hunkering down. As you look at what's going on, we're losing this. You saw yesterday, Director of CDC said we think that we're going to see over 3,000 people, literally the number of people who died in 9/11, every day for the next 1 to 2 months. We're seeing just unprecedented spread, and people and the businesses are very welcoming, and we're very, very pleased. I thought we would have had a lot more challenges here based on everything you read in the news, but it's been really going well so far. So thanks for asking that, Maticia.
Great. Thank you, Kurt.
Well, thank you so much. This is a terrific update, and really appreciate all of the work. Very encouraging.
Yeah, excellent. Thank you. I look forward to giving another progress report, and we'll talk about the vaccination in the coming weeks. Take care. Thanks, everyone.
Good. Mark, we're going to turn it over to you for an update on Greenlight Durham.
Perfect. So thank you, everyone, for having me here today. I did want to also bring my partner, Karina, who, if you can introduce yourself quickly.
Hi, everyone. My name is Karina Moreno Bueno. I am currently a program coordinator for Greenlight Durham. So I am the point-to person for any questions, Greenlight Durham, any troubleshooting, anything related to that. So I'm Karina's main champion on the Duke side, and then she is really the boots on the ground. So I'll share my screen at this point. So do folks see this?
Yes.
1 second.
And welcome, Karina.
Thank you.
So Greenlight Durham, I think the timing of this is perfect because we're going to build off of some of the things that Kurt said. 1 sec. So I'm going to take a moment to read the 6 insights we surfaced over the summer that continue to drive the work. When communities constantly feel ignored or see resources flowing in another direction, they're primed to mistrust outsiders. For many, caring about COVID is a luxury in the face of more pressing and urgent needs. Contact tracing and symptom tracking asks the vulnerable to take on more risk than it's worth. Technology makes the public health response more efficient, but further alienates the most vulnerable. Trust comes easier between people with shared language, culture, and experiences, and holding the community's trust is a heavy load that response workers are not always prepared or equipped to bear. And these were surfaced based off of interviews with individuals, but I think there's a lot of parallels with what we see at the organizational level with the businesses that we're trying to support. So the reality is that despite this being a universal experience for all of us living through, this has been a very isolating experience for many of the business owners where they feel lost, confused, don't have the information that they need at their fingertips to carry out the next steps for what they need to do to support their businesses or their employees. And they don't have the tools. We've heard so many times, I know how to run a restaurant, I don't know how to run a public health agency. So the reality is that these folks need support. We need to surface the community resources, the policies, the best practices, the tools, and we need to coordinate that around the businesses that are in our community. Also be, in many ways, an intermediary between the city, county government, public health department, and these businesses, making sure that they have what they need each day. So 3 kind of core components of what we're doing. One is streamlined access to testing with no out-of-pocket costs, and I'll talk a little bit about the no out-of-pocket costs in a minute. Second is this community monitoring within an employee group. And then third is making sure that folks are also connected to the social services, community health workers, COVID relief payments. So I'll show you quickly what the technology looks like today, which each week we've been pushing updates also to make improvements. So I am an example of a person who would be using this both for myself as an adult and for my child for her school or education. So I would first fill this out for my daughter, Arya, who's 5 years old. A few quick questions. I would then fill it out for myself. We give a GIF to parents that's pet or child related every day. And then back on the home screen, we have the testing resources. So the phone number, how to navigate the hotline, what to expect as next steps. Here we have a community health worker request form that can be submitted in English or in Spanish. These are the services that the CHWs are prepared and equipped to make referrals to. And these are folks that are already funded out there in the field. These positions were created in August, September through state funding. We also bring together state resources. There's a CCNC nurse-driven hotline. There's a childcare hotline. And then this triggers sending an email that ultimately ends up with Karina. So I'll give some quick updates and then next steps that we see. And it'll touch on the vaccine question too, Commissioner Jacobs. So updates on our full, this is about the end of our week 2 of running at full speed. So one of the big things was getting on a full-time program coordinator. So Karina's been meeting with businesses, new businesses, existing businesses that are using the tool. We have started a weekly newsletter, weekly office hours. One thing that we're really excited about, because when the businesses first started coming to us, and I know that folks in city and county government have heard this too, they want rapid testing. Us referring them to PCR tests that take 24 or 48 hours to return, that's not what the ask was. The ask was, hey, we're hearing about these 15-minute tests, 30-minute tests. When can we get those? So we're actually really excited to be starting. We're going to be doing a pilot with 2 Durham-based charter schools for the Abbott Binax Now, which will at least give us some experience with implementing these community-based rapid antigen tests. We've connected folks to community resources, meeting with more community groups that provide services. I know Pilar is on the call. We're going to be meeting with El Centro Hispano soon as well. And then identifying what the right distribution channels are to reach the businesses. And I think a big partner here is going to be the community ambassadors. Publicity, we've met with folks to talk about kind of the adjacent use cases. So congregate living. I think Karina, right after this call, is meeting with urban ministries we've had a dialogue with them, several kind of meetings to figure out the best way to support their employees and their beneficiaries. And then also we've met with the public health department to explore long-term care. Challenges. So these are quotes from business owners. I think the insight that thinking about COVID is a luxury, we continue to hear that. The top quote, I'll never forget, I was on a call with Karina. Karina asked, how are you doing? And this was like the first sentence that the business owner said. It was the start of winter where it's 30 degrees outside. This person said, I sell outdoor dining. These are going to be an incredibly hard 3 months. The second quote was also this is actually from an email. So, I mean, in this context, the restaurants are dying. I think this business owner is very concerned about restaurants going out of business. So that's what we're hearing. I think that we're showing up, people hear that what we're doing is valuable, but there's clearly this other set of needs that are much more core to just the existential threats that these businesses are facing. So some challenges are daily use by everybody every day. There's this neat divide that we've heard front of the house who are mostly customer facing, hostess, waiters, mostly English speaking, much more rapid to adopt the tools and support services than back of the house. And interestingly, that has also driven to Karina planning more boots on the ground engagement in person, doing trainings with staff. So this is not the sort of thing where we can just stand up a Zoom and reach lots of people and then they sign up. So a different type of engagement approach. And I think the community health ambassadors are going to be key to that. We want to broaden the community resources. This is going to be more high touch than I think, initially were hoping for, but that's the reality of building these relationships and building trust. And then finally, whether it's through us or whether it's through coordinating other resources, just keeping in mind the existential threat that the businesses we're working with are facing. So some next steps that we're planning on. So for folks who are familiar with the timing, Greenlight Durham, it was approved as a phase 1 for 2 months. That'll take us in through January. And then our goal would be to propose another 6 months. And a big part of that is going to be vaccines, public health education. We've been meeting with DPAC, and we think that that's one of the most interesting and urgent users of a vaccine registry if and when that gets up and running? And how do we start to bring back online some of these other activities that are more dependent on vaccines? Public health reporting, we're going to get some experience with this with the Binax Now program, more tailored community resources for employees, for owners, for customers. We think that this is going to be a really valuable distribution channel for public health education material. Right now we do a GIF, but you can imagine every day when we're presenting people with questions and material that there's going to be ways to kind of tee up other type of communication material related to vaccines and public health activities. We are also interested in developing playbooks. So these, I mean, there was a scenario a few days ago where somebody emailed us asking, I have my first positive case. Can somebody get on the phone with me? And then one of our team members did call the person and walk them through the public health guidance, but this is already happening. Folks need real-time support, and that also plays into the hotline. So one thing too that's been core to how we've built the technology is this is on HIPAA, FERPA compliant servers. Individuals authorize a business or a school to get access to updates. They can revoke the authorization, they can delete their data. Onboarding is completely self-service. You go to greenlightdurham.com, you can sign up your business and then send it out to your employees. So as I mentioned, the primary point of contact is Karina. There's a great leadership team supporting her from the Greenlight side. And then there's all the folks at Duke who are also trying to make sure that this is successful. So thank you. Karina, did I miss anything? What are you hearing? And yeah.
I think Karina may have had to step off to meet with another.
Okay, she's meeting with Urban Ministries right now.
But thank you so much, Mark. That was terrific. And again, really impressive work here. Are there questions for Mark? Chair or Commissioner Jacobs?
I hate to be the one who keeps raising my hand, but Mark, I'm just, again, I'm just so blown away by everything that everyone is doing, and just, you know, what you all have rolled out so quickly, and you know, and just the approach and everything is just fantastic. I'm wondering at this point, what is the participation rate and what is your capacity? And yeah.
When we first started building the technology, we were in conversation with the state about a state level app that could be used for over 1 million kids. So we immediately acquired cloud infrastructure for that. Sorry. So we immediately secured cloud infrastructure that would support that scale. So the barrier here is not the technology, it's the relationships, and it's the daily behavior change. So there are 42 businesses onboarded. We have 180 active daily users, which for us is the important metric. The businesses that we have engaged, they cover closer to 600 or 700 employees, but the system's most effective when it's used every day by everybody. The example that we give people is, let's say I work in a restaurant and I work every Friday. I can show up to work feeling fine on Friday, but I can wake up Saturday with a fever, and the business owner would want to know on Saturday. So this isn't something that's tied to showing up at the workplace. So for many of, I have a kid, I drop off my kid at school every day. They primarily care about the days that I drop off my kid. And I think that's also the mindset as a workplace support program, that this is something that's only for while you're at work. But this is, so for us, the messaging is important, and continuing to meet with people and provide that context of the behavior changes that we're trying to drive are every day. And these are, whether it's wearing a mask, whether it's social distancing. So that's the challenge. So that's our primary metric is active daily users, where we're at 200, but we're that's why right now the priority is the distribution channels, the partners, and that's where I think the community ambassadors can be very key.
And just to follow up, Mark, do you have like disaggregated data as well? Like who are these people, race, gender, all the things we track? And do we know if any of them, for instance, are Durham Public School families? Because I think ultimately we need to look at how do we integrate all of our systems and thinking about, you know, our schools, families as being central to our community.
So we have launched in 6 charter schools in Durham. I can presume that many of these employees have children. The line that we're trying to walk is the collection of data. So I know that Pilar, who I've spoken to many times, when we were talking to folks about the Pandemic Response Network's initial program called Community Health Watch, it takes 10 minutes to answer all the questions, to register, read through all the documentation. There's a lot of personal information, whereas the way that we built this was under a different set of assumptions. That was just the most important thing is to get the basic information every day. So all you need is a phone number. You don't even need to use a real name. You can use a nickname or alias. So we minimize the personal information that we ask for. We definitely understand the need for reaching the hardest hit communities. I think we've been approaching it as understanding what the businesses are that have that cohort of employees, but it is a need to have that information. I think for me, the easiest way to gather it would be through the employers getting their demographic data for their employee populations, or if we felt like that was required to ask for employees. It's just that every additional piece of an identifier, we know there's going to be more hesitation. So we don't ask for address, we don't ask for date of birth. And I will be clear though, when we have to do public health reporting, so for the Binax Now tests, that information will need to be collected, but we'll treat it more like a credit card. You know, when you make an online transaction, even though the system can remember the credit card information, it still asks you for the credit card information so that you're aware that you're entering it and it's being shared in that transaction. So trying to frame it more as at specific moments, we may need more data, but that's not going to be something that persists in the system indefinitely.
Great. Well, thank you so much. Really appreciate, again, all of the work on this and such a great update. So thank you for joining us today.
Thank you. And it's been a pleasure, and we look forward to continued collaboration.
Great. Thank you. All right, I'm going to move us on to our priority updates, and we can start, I think, start this morning with Mayor Schewel.
Thank you very much, Katie. We've already had a great meeting today. I'm going to just share a couple of updates, but really good to see everybody. We all know about the governor's new modification of his order, which we're adopting in our local orders. And in that respect, I do want to recognize our new county commission chair who's with us today, Commissioner Brenda Howerton. I see she's here, but maybe has stepped away from her camera for a minute. But we're really pleased to have Commissioner Howerton with us. And she already had to sign her first emergency order to coordinate with the governor's order. So we're on it. But we know that we're in a difficult situation. I believe yesterday we had, Rod can correct me, but I believe we had 150 cases yesterday. We haven't seen a day like that in Durham. So we know that even though I hope I'm not stealing Rod's thunder here, but we we saw the Duke report. Our infection rate is still half of the infection rate of the state, but we continue to have more cases than we did. And we've been moved up, as you all know, from the yellow into the orange category on the state's charts. And so we just have continued increasing cases and concerns, as well as Durham is doing relative to everywhere else. We can take some comfort in that, but we certainly can't take any comfort in the rising cases. One of the responses to this, and is Nicole may want to speak about this later, but Nicole took, I think, the very difficult, but I think very responsible step of canceling the streetery, which has been really great. I've been down there almost every weekend eating in a restaurant. But with the increase in cases, Nicole had been hearing from folks, including some people who work in our restaurants, and has had to take that very difficult step so that we're not drawing people together in crowds. And I know how hard that was for her. And I just want to tell her that she has my support, and I know that she has our support in what is always just super difficult kind of decision to make. I do want to say I put out yesterday, I've decided, and Amber helped me with this, and Ryan, that I'm going to, after Thanksgiving, I was thinking how grateful I was for all the people who've worked so hard to keep us safe. And so I'm putting out a series of thank you videos every Thursday for a while. Some of you all are in the first one. It just came out. A few of you all get some special shout outs. Next week, I'm focusing on everybody who's helping Durham mask up. We counted up, and I think we know that we've given out at least 350,000 free masks to our vulnerable populations in Durham in the last 9 months. And so next week, I try to highlight a lot of the people who've helped us do that. And I'll have other themes going forward, but I wanted to let you all know that. And so you can check out my video online. I don't have much of a social media presence, but you can find it. I want to thank our Office of Economic and Workforce Development. We reallocated $250,000 of our CARES funding. We have to get all our CARES Act funding out by the end of the year. And so we reallocated $250,000 of it. The county did the same. So our Office of Economic and Workforce Development has already put out the first half of that, $250,000, and we're putting out the next $250,000 in grants to our small businesses. So we'll be able to help another probably 70 small businesses with grants. And I want to appreciate our department for springing into action to do that. And that's on top of the $1 million from the Carolina Small Business Development Fund grants that have also now been fully used. Maticia's off the call, but I did want to appreciate, since we last met, that Blue Cross Blue Shield donated, I'm going to get this number maybe not quite right, around 250,000 bottles of hand sanitizer and I think 50,000 masks. I'm not sure how those numbers are exactly right, but we really appreciate those. And Ryan's saying that is right. So from Blue Cross Blue Shield, which was great. I think that's it for my updates. I'm so thrilled about the possibility of the vaccine, but we just have to stay safe and do everything we know we need to do till then. And I see that Amber has put a link to my video, so check it out. I mean, I'm not much of a, like I say, my social media is pretty weak, but I am enjoying doing these. Thanks, everybody.
Thank you for, sorry, I want to say thank you for naming the health ambassadors. I shared it with them yesterday and they feel very proud of it. So thank you.
Yeah, thank you, Pilar. I'm trying to actually name the names of the people who are doing the work, not just the institutions that they work for. And yeah, if you all have suggestions for people I ought to be thanking that are on the front lines, I would love to know that. You know, I'll give you an example. I'd like to do something sometime soon on our contact tracers, and I'd like to name the people who are behind the scenes doing the contact tracing. And so, yeah, please, any people that you all think like that ought to be thanked, or, you know, maybe some of our pastors who are really doing a great job of trying to keep their congregation safe. Those are the kinds of things I'm thinking about.
Well, thank you, Mayor. And I didn't know about this campaign, and I think it's fantastic, because here we are, 10 months in, and, you know, we've gotten here because of all of the people behind the scenes who've just been working every single day. And, you know, it's literally has saved lives. I mean, we know that. That's what it means. I mean, all of these collective actions, when I think about the fact that, you know, we were the first community to, you know, require masks back in April. And how many lives has that saved? And, you know, it's hard to see our infection rates increasing, but when we see that we're still half the rate of the state, we know that the foundation has paid off of everybody's collective efforts. So thank you for that, Mayor. So I think for me, top of center, I'm thinking about that, you know, grateful for this task force, because I think that the model that we have of having a body like this and all the roundtables that's connected to the community, that is informing what we need to do, that can be very nimble and innovative and act quickly, has been really key. And then bring things back to the city and the county governments. And so one thing that I do want to propose to the task force is we're hearing a plea for help from our schools, from our school board, from our school community, that if what can we do to really wrap the entire community, all of our stakeholders, all of our resources around our schools. We had a joint city county meeting on Tuesday where we were talking about the Hope Learning Centers and the Durham Public School learning centers, and just all the unknowns around how can we even possibly reopen. And a lot of it is concern about making sure our schools have the resources they need collectively from all of us, and how it's really going to take the whole community to do that. And even thinking about how we would roll out vaccines and access to resources. When we think about who are trusted community partners, where are the relationships? We know so much of it is our schools are the center of people's lives. And even thinking about our employees, our bus drivers, our nutrition workers, our janitors, our teachers, is, you know, all of the workers. So how can we really think about the relationships? So what we heard in that discussion was, and just in some follow-up conversations with school board members, is really wanting help from the task force to help start those conversations. So I just want to throw that out there. You know, we have an education roundtable, but it's very focused on, you know, high level with all of our institutions, and we'll, you know, Duke and Central and Durham Tech, School of Math and Science. But this would really be a roundtable that is focused on K through 12, really on the K through 12 school communities. And so I hope we can talk more about that later on in our meeting, about how we can help with that conversation and bringing people together. The other big thing that I just want to bring up is thinking about the impending crisis with evictions. The eviction moratorium ends at the end of December. I know that there are conversations at the governor's level about hoping that the CDC will extend the moratorium. There have been conversations about the Biden administration implementing the moratorium, but there's on, you know, January 20th, but there's still that 20-day gap. So I just want to ask everybody, in whatever capacity you have, in your connections and conversations to be talking about this and encouraging that there is an extension of this moratorium at the end of this month, which is only a few weeks away. Also, it is in our materials, but the good news is we did get an additional $3.6 million worth of HOPE funding that will help with funding the 24 applications that we did get in Durham. But those are just the applications that were in the pipeline. The other good news is that the city is getting an additional CDBG CV. I don't know if that's the right terminology. That is the for rental assistance, and so that has a longer timeline that will go beyond December, and there's still decision making about how best way to use that. And then also the LEAP funding has started, which is really important. Right now it's for seniors to help with utility assistance. In January, it's for everybody else. And then the county, we will be taking up extension of our food security funding programs, and also for seniors and families. And then the homeless program, extending those, and then also to support the virtual learning, because all of these really kind of run out at the end of this month, and we have to look to kind of what comes next. And I think that those are the main things. Oh, and then just that the Duke COVID support, thank goodness, has also gotten renewed funding. So that is really, really good news. And as the mayor said, the county is participating in the grant program for our small businesses, which we know are just hanging on by a thread. And so I think that is my update at this time. Thank you.
Thank you very much.
And I think Chair Howerton is back. We were just recognizing you when you were off screen a few minutes ago, Chair Howerton. So I just wanted to recognize you here. And
thank you so much. Thank you. Good morning, everyone. Yeah, I'm multitasking over here.
Good morning.
Good morning. And have a safe and great holiday for all of you. If I don't see you again soon.
Thank you. All right, I'll provide a couple of updates from some of our roundtables. So we did have our education roundtable. We met, I guess, about a week and a half ago, and got some good updates from all of our schools, including Durham Public Schools, about the plans for return to school in the January timeframe. All of the schools have been doing very well in terms of, and really proud of them in terms of how they have been able to manage for the fall semester. They have managed to keep the number of cases to a minimum. Particularly proud of NC Central and Durham Tech and science and math as well. Durham Public Schools is planning to go back on a B schedule, which would be hybrid for, I believe it's hybrid for those, and I'm looking for my notes there, in K through 6. And I know that there's still ongoing discussion with the schools, but again, Dr. Monk felt like they were in very good shape and prepared to go back. So we'll talk offline after this about the idea, like that concept of a K through 12 roundtable. We had a very good meeting with our restaurants. I think you heard from Mark Sendak and saw the couple of quotes on his slide, which I think really sum it up for our restaurants. They are feeling incredible strain and a lot of confusion about how to manage when they do have a potential exposure and what steps they need to take and how to get tied into testing. I think many of us are hopeful that the Greenlight Durham will really help with that. There are a couple of other things that they would like to see, which is a hotline for specifically for our restaurants and our small businesses. And that did go before the county for potential CARES Act funding back on the 23rd of November. However, because the CARES Act funding runs out the end of this month, there would not have been enough time to get that in place and up and running before that funding would likely run out. So that is still something that is outstanding in terms of having a dedicated hotline. But in the meantime, Greenlight Durham and the ambassadors working together are really working to support those restaurants. Nicole, anything else to add there? Okay. The Blue Cross Blue Shield donation was mentioned. So very thankful to Blue Cross Blue Shield for their contribution of 250,000 hand sanitizers and 50,000 face coverings. And if you have suggestions or ideas for where we can distribute those, please let us know. Because we're looking for, and there are a number of opportunities already that have been identified, but there is plenty to go around. And we certainly want to get those out in the community. And then we have the upcoming immigrant and refugee town hall and workers town hall. Both of those will be held in January. So those are more information to come on those. And with that, we'll move right into our numbers, our metrics update. And I can start, before I turn over to Rod, I'll start with just where we are as a health system. On November 13th, between both hospitals, Duke University Hospital, Duke Regional Hospital, we had 66 COVID patients between those two hospitals. Currently, we have 90. 27 of those are COVID patients who are recovering in the hospital, but are off of isolation. And then we have 63 who are active COVID patients right now. So the numbers are certainly up. We are managing. We continue to be at 90+% capacity among our hospitals. That is not unusual for us. There are times of day, days of the week, when we are much higher than that and really at approaching full capacity. And there are other days where we are closer to that 90%. But certainly we are, most of those patients still are not COVID patients. So I think that's an important point to make. And that's why we're so concerned about making sure that there is vigilance in hand washing, wearing the mask, staying apart, not gathering, especially through the holidays. And I know that's really hard for our community, but the reality is that there are so many patients who need our care that if we see a significant influx in COVID patients, that will certainly make things very challenging for our hospitals. And so we have plans in place. We will be able to take care of this community. We are committed to taking care of this community, but there are preventative steps that everyone can take that are really simple. And so we want to just reinforce those. And with that, I will turn it over to Rod for additional metrics.
Katie, could I just step in for 1 sec? I'm sorry. Could you just let us know, we hear a lot about concerns about the ICU and the ventilator situation. Could you just mention those real briefly? Absolutely.
Our ICUs, particularly at Duke University Hospital, run fairly full every day, particularly this time of year when there is a lot of respiratory illness out there. So that is not unusual for us to have full ICUs. They are not completely full of COVID patients. So again, about 6% of our patients across the health system who are currently hospitalized are hospitalized with COVID. That means 94% of those who are hospitalized do not have COVID, but have other significant illnesses that require hospitalization. So are our ICUs, are there days when our ICUs are are full or near full capacity? Absolutely. Are they full because of COVID? No, they are not. I don't know if that helps to explain it.
That helps a lot. Thank you. I just think we need to keep getting that word out. I hear a lot of, I would say, rumors that COVID is filling up our ICUs. And I just think we need to make clear to people that that's not the situation we're in, but we need to be vigilant to keep it that way.
Correct.
So thank you.
Correct. Thank you.
And I do agree with Mayor Schul. I listen to NPR a lot, and they pretty much said, I think earlier this week, they were saying that we may be 6 or 7 weeks away from being, away from not having enough beds and stuff. So this information that you're providing, Katie, is very reassuring. We always want to know the ground truths and what's going on. So, it's comforting to know that we're in a good position. Ladies and gentlemen, and to the Durham community, I just want to really be straight with you like I've been throughout the entire pandemic and let you know that we're in a very dark place. Mayor Schul said it best. The numbers are staggering. This is the first week in which we've seen triple digit over 100 cases consecutively. Most of the numbers statistics that I provide to Ryan is for the week prior. But right now I'm talking about this active week. And we have seen 150, 146. Yesterday was 110. And make no mistake about it, we knew this was coming because of Thanksgiving. But what's scary is the numbers were already increasing prior to Thanksgiving. And we truly believe that we've not seen Thanksgiving numbers yet. So we have a couple of dark months ahead of us. And the only thing we can do is just really band together as a community. And everything Katie just mentioned, this is a preventable disease, period. It's preventable. All we have to do is just practice the 3 W's. But most importantly, in the absence of a straight up curfew or stay-at-home order or just lockdown, we just really need for everyone to stay at home. Just practice remaining at home, staying safe, because that's truly the safest place to be. Because you know that in your home and in your pod or in your area, it's clean, it's sanitized, everyone there is squared away. So I wanted to start off, as Susan always holds me to giving a banner, if you will. But I just wanted to say we do have some dark days ahead of us, but we will make it out. We will be fine. It will be okay. Currently, we're sitting right at about 708 active cases. We have 11,698 discharge or inactive cases. The number of deaths did increase and has been increasing, ladies and gentlemen, because a prolonged period of infection with people who already have significant health concerns, multiple chronic conditions, and who've been hospitalized for quite some time are bound to succumb to COVID-19 because it is still a deadly respiratory pathogen. I know I've been saying it a million times. I can't say it enough. COVID-19 is currently really killing 2 U.S. citizens per minute. 2 U.S. citizens per minute, which equates to roughly 2,500 to 3,000 U.S. deaths per day. And it's staggering. It really is. Continuing on, we are at 128 deaths. And that brings our total for the pandemic to 12,539. Much has been said about the vaccine. I'll get to that a little bit later. But as of last week, our 7-day moving average was 95. This is an increase from 80 2 weeks ago and 72 the previous week. So we can continue to see how the numbers are continuing to increase. So far for the month of December, with just 11 days in, we are having 668 total cases. The disease burden in North Carolina and Durham is increasing. However, as far as race and ethnicity, ladies and gentlemen, there's slightly a pause for concern. Our Hispanic or Latinx population continues to be overrepresented, but it's right at 19.4%. So again, it continues to go down. Our Latinx population, our Latinx healthcare advocates have done a marvelous job, and we won't stop until it gets below 14% because that is where they represent in Durham. Of concern recently is the fact that our Black or African American community in Durham is now overrepresented. They represent 40.9% of our cases, only representing 37% of our population. So we certainly want to begin to really emphasize to the African American community, which already were doing fantastic work in terms of COVID mitigation and COVID response, but we are a data-driven organization, and right now the data is most certainly showing us that there's overrepresentation in our Latinx and our data population. With that being said, we certainly have a lot of work to do. Underrepresented continues to be our white population at 27.7% of our cases, although they represent 54% of Durham's population. In terms of work, we're still seeing a lot of infections in professional, scientific, and technical areas. But of course, construction, where our Latinx males are continuing to be infected in high numbers. But hospital, general medicine, surgical units, where Black or African American people work, that's becoming more and more robust. And that's to be expected, ladies and gentlemen, because that's where COVID is. COVID is in our hospitals, and these folks are taking care of our residents. So we continue to keep an eye on that. Our percent positive, Mayor Schul has already alluded to, in that we have lots of different numbers. However, our number for last week was 6.3%. Duke's model has us at like 5.4, I believe it is. So we continue to hover in the 5-6% range. But again, it continues to go up from a week-to-week basis. And that's indicative of the infection rate that is currently ravaging Durham. We keep an eye on school-age children. And so far, they've only represented right at about 56 cases in the month of December for a percentage of 8.38% of all of our cases. And that is kids who are 18 years of age and under. In terms of more discussion about the vaccine, proud to report that in my weekly message that I will film in about an hour, we're going to talk about the COVID vaccine and just really letting our residents know, which I firmly believe helps, is transparency. The more information that they can have, the better. And we do recognize that getting vaccinated truly is a personal choice. For some, it's a job requirement, but by and large, for the vast majority of our residents, it's a personal choice. And before you make any life decision or any personal decisions, you want to be armed with all the information that you need to make an informed decision. So there are a lot of questions about vaccines. So we want to be able to dispel rumors and just answer questions about how safe they are, the side effects. So we've created a page on our website. It's decopublichealth.org/COVID-19 vaccines. And we hope to have a lot of information out there as it changes. We have links to other sites in order for our residents to have all the information that they need. We are also planning to do a survey to really hear from our residents as well, and to really gauge how they feel about taking the vaccine. It also helps us as an organization to plan as far as numbers and where we can start targeting vaccine when we are able to go out. As it stands right now, with the cold chain requirements, we're going to have to pull residents in, and they're going to have to go either be treated at Duke or at the health department. But we hope to change that soon. I know we have a limited amount of time, but I do want to open it up for questions.
Thank you, Rod. I just want to reiterate what Rod just said about these are dark days. So even though I say we are managing in the hospital and we're managing the volume that we're seeing in the hospital, we are very concerned. I'm very concerned about the days ahead and what that could mean if people don't maintain vigilance through the holidays, because we certainly are seeing those numbers, as Rod just mentioned and just shared, seeing the numbers increase post Thanksgiving. And so we are concerned about the holidays and just really want to reinforce that need to, as difficult as it is to be away from family, just think about the holidays next year and being able to celebrate with them, and how devastating it would be to not be able to celebrate with them because someone has died of COVID. And so we just have to reinforce there is a light at the end of the tunnel on this, but there are going to be some dark days ahead. So we've just got to keep people vigilant. All right. I think the next section is really open discussion. So this is time for any other questions, other topics that that folks would like to bring up.
Katie, good morning, everybody. It's great to see you guys. So good morning. We touched on this a couple of times. I've been particularly concerned about Durham Public Schools of the school-age children. You know, having seen a number of reports on the unprecedented drop in enrollment around the country. You know, students who are just basically missing from school because, you know, they're not in online school. Do we have any information about how we're tracking or faring in terms of our enrollment and any, you know, the COVID impact there?
That's a really good question. It did not come up at the education roundtable. So I don't know if there's anyone else here on the task force who is aware.
I was on the education roundtable with you, Katie, and we can kind of piggyback, but Dr. Julius Monk did mention that, you know, he was very transparent and said that they were not without a few cases, but it mainly was in the staff, not necessarily the children. He did not really touch on the enrollment, Lois. He did say that the kids were most certainly, you know, he recognized that there were some difficulties in terms of kids in the new environment as far as remote learning. And he made no mistake about it. There's nothing that can compare to forward-facing traditional classroom settings. He also acknowledged that there is a dire need for kids to be back in the classrooms, but he did say that, you know, of course, given the infection rates and everything, and, you know, the current rise in cases is, you know, preventing that from happening. I'm so encouraged by Commissioner Jacobs and Commissioner Carter and the rest of our commissioners who really heard at the joint city-county meeting on Tuesday, and really, really pitched us formulating that new task force, or new roundtable. And I think also I wanted to throw out that they also want students and parents to be a part of it, because we want to hear from them and, you know, get that ground truth from them as well. But not meaning to dance around your main topic, which is enrollment. I've not heard anything about a dip in enrollment, but I have heard nationally about how truancy officers are having to go knock on doors and everything because kids are not logging in, they're not checking in, they're losing track of them. But honestly, I've not heard about that in Durham. But I am really wanting to participate in this newly formed roundtable, not only as as a parent, but also as someone who really wants to help our schools, because I want our kids to be successful. And I do realize the predicament that Dr. Mabenga and his team are in. It's tough. And you certainly have parents and teachers who are very concerned. So it's a very fluid situation.
I think the biggest concerns revolve around, I think I just caught the end of the 60-minute piece. It really was around particularly low-income students and students who were already vulnerable when parents lose jobs and they maybe just up and either move or they don't have stable housing. So that was part of the concern too. You know, those who are most vulnerable anyway just fall through the cracks, and you can't follow up in the typical ways you would if, you know, in non-COVID times. So.
Katie backed me up. I could just tell by, even though we're in a virtual environment, you could see the concern.
Yeah, absolutely.
With Dr. Monk. I mean, it was tough articulating where they are, and the passion is there. But you know, as with the rest of us, we're all handicapped by this pandemic.
Yeah. Yeah, and I you know, one clarification that someone made on this that I should mention is Durham Public Schools will only go back in January if Durham's COVID metric is 4% or less for 2 weeks in a row. And that is going to be a tough bar to meet. But again, if we as a community recognize that getting our kids back in school is best for our kids, then we as a community need to come together and say, we're going to do everything we can to protect each other so that our kids can get back in school, right?
I totally agree. And that's a question I received from some high-level officials yesterday, and I couldn't have said it better. That's exactly what I said inside the reply. This is everyone's task. I mean, we're all going to have to look out for our babies. And if we want to get them back in school, that's what's going to happen. That's what's going to have to happen. We have not been consistently under 4% since early September. And it was only 2 weeks. That after that second week of 3.7, we automatically started going up toward 4. So this is a collective effort. It truly is.
Yes, Commissioner Jacobs.
I just want to respond quickly to what Lois said. And I think that's why we really need to have this K through 12 roundtable to help, you know, everybody come together. I'm sorry, my dog is barking, and collectively address all these issues. I do want to say that's why the Hope Learning Centers that the city and the county are supporting, and the ones that Durham Public Schools has, is so important, because they are trying to at least help some of our most vulnerable students, you know, our Durham Housing Authority families, students who've been referred from social services, foster care, the students that we know are already the most vulnerable, and making sure that they don't slip through the cracks. But we're only touching the surface with that, and we definitely need to do more. Thank you.
Thank you.
So Katie, I'd just like to remind everyone that we're still in the flu season. So far at Lincoln, we've administered over 9,000 flu shots. But if there's anyone out there who have not yet gotten your shots, please go get it. We have a few months to go left in the flu season.
Great point. Thank you. Thanks for that important reminder. Yes, Pilar.
Yeah, thank you. I just want to, I know we've talked about this and everybody's concerned, but I really think we need to get together and have a plan to communicate to the community about the vaccine, because we keep hearing, at least from our community health workers, all the concerns from the community, all the false information or misinformation there is about it. We just had last night a meeting with 30 of our community health workers and Dr. Leonor Corsino and Rosa Guardia from Gonzalez Guardia from Duke talking about this, and had some ideas how they feel the communication could go out for our Latinx community based on what they are hearing and everything. And we are going to start like some talking points, and they gave good ideas about videos from our own community who have had COVID, talking about the experiences, or even them getting some of the vaccines. But I think we've seen as an organization a very good impact when we had, or we still have the NC Unida contra el Virus communications campaign, when everybody's sharing an unified voice and messaging. And so everybody, is overwhelmed with all these graphics and everything. But I think that really helps when we get together. So I think we really need to come up with a plan to have a unified voice with the health department. Also because even I feel sometimes I don't have all the information, all the answers. Even yesterday, we, both of them, Leonor and Rosa, they said, we don't have an answer for this. We can't really tell the community this is plain like this because it's new. But I think it will be important to have a unified voice and get all these planned together so we can get the people really getting vaccinated.
Absolutely. Could not agree more. Thank you. And I know we've started talking about that.
Katie, if I could for a second. Oops. Go ahead.
Oh, go ahead, Geoff.
Now, I'm not sure, and I apologize if somebody had mentioned this already, but I did want the group to be aware that the state recently opened the Retool NC grant program for the second round of funding that'll support historically underutilized businesses that are impacted by COVID-19. So they'll have another week to apply for some grant funds through that. I'm not sure if we've mentioned it or not, but I do think it's important to promote that opportunity.
Excellent, thank you. And if people have questions about that, where should they go for more information?
We'll throw something in the chat, a link for that. I think well, I can pull that up for you.
Perfect, thank you. Yeah, and I know we want to spend, I think, a good portion of our January meeting really focused on that pivot toward economic recovery. And so focusing on our businesses and the needs that they have over the winter months and moving into the spring, and how we're going to really support equitable economic recovery moving forward.
To piggyback on that and comment on it, we've put in a couple of proposals. One on behalf of the communications work, the Back on the Bull campaign, to give everybody an update, was scheduled to run through the end of December, and I'm told it runs through December 30th. But then that campaign will be out of funds, but we put forward a proposal for funding for the next 6 months, anticipating that there's still going to be a tremendous need for communicating what the current orders and guidance is, and about the vaccine rollout, and a lot of other things. We also put in a proposal related to economic recovery for festivals and events, which is something that we've talked about a few times here. The challenge of trying to plan for things that where we don't know when they can come back, and it takes many months to plan them, but we do have an approach now that we think will be productive. So both of those things are in the consideration phase right now.
Great, thank you. And I know that our small work group of the budget subcommittee, if you will, of this task force is meeting, I think it's either Tuesday or Wednesday. So I think it was Tuesday at 5. Ryan is letting me know.
Katie,
yes.
I don't want to put Reverend Davis on the spot, but I'd love to hear from him on behalf of the faith community. Any concerns he's been hearing about the vaccine, or anything he feels would be helpful in terms of communication and getting the word out in within and among faith communities and the broader community?
Thank you, Lois. I've been on several calls, several Zoom meetings the past couple of weeks around this whole getting the vaccine out and African-American participation. What we are continually hearing is that you still have a variety of perspectives within our community, and that you still have a number of people who are just outright nervous. And so what has been talked about in some of the calls that I've been on is trying to, first of all, create partnerships and collaborations with the agencies and the departments that would be able to help disseminate quality information. Because one of the things that that we worry about is the selective choosing of information. I think, like Rod said, earlier, you get people saying one thing and people grab that and they run with it. And so on one of the calls, one of the clergy brought up the very bold fact that in some congregations, there are going to be people who, if the clergy leader says do it, they're going to go out and do it. And there's others where they're going to still be hesitant. But if people have the various side effects that were mentioned earlier and they weren't expecting them, there will be people that say, my pastor, my clergy, my rabbi told me to go do this and look what happened. And one clergy even brought up the concern, what if someone takes it and they, God forbid, they pass, they die? One negative, especially in the Black community, the Black religious community, one negative experience can influence a lot of what's going on. So what's been talked about is trying to inform clergy leaders so that they'll have enough information to be able to share quality information. Some clergy leaders are talking about their willingness to be upfront and take the shots and let it be seen. Others are talking about the need for short videos or brochures. But then also, I think what's been resonating as a foundational piece is whoever the different medical and health agencies, is there a way to develop sustainable relationships between the faith communities and these groups that is beyond just this is COVID, but because we're going to have health issues all the time. And if there can be sustainable collaboration and relationships, maybe people may not jump on the vaccine when it first comes out, but they'll be open a month or two down the road. Because at least in the Black church, we teach this among leadership. When the pastor's tired of saying it, that's when people are just starting to catch it. So what if when people are tired of talking about the vaccine and somebody is just ready to hear about it and we've stopped the partnership and collaboration? So that's just some things that have been talked about amongst various faith leaders. And I think it's probably been 3 different calls that I've been on the past week to 10 days.
That's really helpful. Thank you.
Would it be helpful, Reverend Davis, if the presentation that Cam Wolf gave earlier, I found really not just informative, but really kind of reassuring. And I wonder, would your pastor group, would it be beneficial to hear from him?
Yes, I believe so. I definitely believe so. And we've been, in our group, when we've heard good things, we try to bring them back. And I think we've seen our numbers, as the spike has increased, we've seen our numbers of people participating increasing as well. So I think that would be definitely helpful.
I'll be happy to help arrange that.
Great.
I think he would be very willing.
Wonderful.
Nicole, I think you had something before we wrap up.
There we go. Very quick. Happy holidays to everybody. This is our last meeting, so happy holidays. But during this time, as we move towards the holiday season and after, it's going to be really, really, really hard for our small businesses. We all know that. I mean, we've been talking about it. Know that many of them are doing curbside delivery, takeout. That includes our retailers. Even though we're not doing the streetery, if you feel comfortable coming downtown and eating and sitting outside, a lot of our restaurants downtown have outdoor seating where there is distance. So that does not go away. We're still working with the city. We're going to extend that ability for those restaurants to continue to do serving food and alcohol in their parking spaces in front of their buildings. So that doesn't go away. Just the closing the streets down so people could walk in the street and the restaurants could spread out. So please don't forget that. But I completely understand with the cases going up, People may not feel comfortable doing that. So I beg you, during this time where it may be easy to go around the corner and pick up something, maybe go a little bit further. Doesn't have to be downtown. I'm DDI, so we'd like for it to be downtown, but support all of our small businesses. And if you can, go pick up so that they're not sharing that cost with a DoorDash or a Grubhub. Nothing against them, but they need all of the money that they can get right now. As you're looking for interesting Christmas gifts and holiday gifts, our retailers can provide that. So just think a little bit. And on those really, really bad nights when you're like, oh, I don't feel like going out, go out, because that's when the small businesses need you the most. That night, they probably haven't had anybody come in. So make that effort. We will hopefully, when the numbers trend down, do pop-up streeteries. So look for that information. I also wanted to share, and it was in the email, but just so that you all, the email that I shared with everybody, but there is a hashtag Durham takeout pledge that everyone could sign up for. Oops, in reading my email, I've lost Zoom, there it is. So that was longer than a minute, but I just want to beg you, and please share with, I mean, Duke Health, there are a number of people that you could push that message out to. The county, there are a number of people that you could push that message out. Our restaurants will not make it without our help. We love them. We always talk about them. We talk about how they're the backbone of the economy. They're the backbone of the community. They're gritty. That's great. Right now, they're not that gritty place because they're just trying to survive, and they need us. They need us to spend money. They need us to tip a little bit more. You know, if you have it in your pocket, don't do 20%, do 50%. They need us. I am scared of what will happen over the next 3 months for these businesses that have been amazing at how they have pivoted and they have tried to do what is right. Our canceling of the streetery was not because the restaurants were not complying. I want to be very clear. They were complying. So please don't forget about our small businesses. They desperately need us. Happy holidays.
Thank you so much for that. Shop local, eat local, use curbside if you're not comfortable otherwise, but take advantage of that curbside and really do what we can to support our small businesses.
Yes.
All right. If nothing else, we are 2 minutes over time, but that was a really, really important message. So thank you, Nicole, for getting that in. Thank you all so much. Happy holidays. Please stay safe.
Happy holidays.
Happy holidays.
See you after June, but hope to see you around.
Oh, and good luck, Pilar. Enjoy your sabbatical.
Bye, Pilar.
Bye.
Bye, Pilar. Bye, everyone. Thank you.